All right, what are the most common concerns when it comes to our skin? Well, it is time to find out, and it's also probably time to find some solutions. Maggie McKernan is joining us from Apex Skin. Thank you for coming in today.
Well, thanks for having me.
I know that, the skin, it can be temperamental. There can be a variety of things that people deal with. Let's break it down, and we'll go with the first one. What's, to you, the most common skin condition that people deal with?
Yeah, one of the most common things we see during skin exams is skin cancer, which is also one of the most concerning things that can develop on your skin. And skin cancer is really very common. 1 in 5 Americans will develop skin cancer over their lifetime. And so it's really important to get in for your annual skin check because skin cancer, when caught early, is very treatable.
When you hear that number, I hope that sticks in your head and you're listening to that. 1 in 5. So I think a lot of people, that is one of the things I think that people ignore. They think, I don't need to go get that annual mold check. I was just out there at your Avon Lake location getting my mold check. Yeah. It's so important to do that.
Absolutely, and especially this time of year when we're all bundled up with our coats because it's so cold outside, it's hard to keep a track of what's changing in your skin. So come in, get a check, let us look head to toe. We can evaluate your moles, your lesions, your rashes. There's lots of different things we can identify during those skin checks.
Okay, so cancer would be number 1. We're trying to avoid that. Figure that out as soon as we can. What would be number 2 for you?
Yeah, we see a lot of things very commonly. There's a lot of chronic skin conditions we identify. Commonly things like acne, psoriasis, eczema. Those are some of the big ones that we are seeing commonly. And the good news is we have really great new treatments and you can get your skin clear. So, if you have, been to us before, definitely come back and we are happy to help you on your skin journey.
So can we hit on acne specifically right now? Because I was just talking with someone I work with too, and they were just saying how even, you think of it in your teens, but this is something that people can deal with their entire lives. How do you help to treat that? And what is the first steps you have to take when you are faced with that and wanting to make a difference?
Yeah, absolutely. Acne, I see almost as many adult women with acne as I do adolescents. And really it's hormonally driven in women. That's really probably the most common adult population we see. And the good news is, 1, we can target that hormonal component for women, but also we have great treatments, both topicals and orally, that can really clear you and clear you long term. So the good news is that they are developing new and better topicals all the time, but also oral options depending on what your specific needs are. Everyone has individual acne needs, so come in, get evaluated, see what kind of acne you have. You can have very mild comedonal acne, which is like the little whiteheads, blackheads, but you can also have very severe cystic acne, which are those deep, painful nodules on your face. And so depending on how severe you have will depend on what treatment you need.
So when you have things like eczema or psoriasis, as you mentioned, are those considered the chronic ones?
Yes, okay. They are. So they are chronic immune-mediated conditions. So it's something that we manage for you long term, but we have these great new treatments that can keep you from having to go through the cycle of flares and waxing and waning that happens with them classically. And the biggest thing is this time of year, psoriasis tends to flare, eczema tends to flare. So, just in the last month in my office, I've seen a lot of new eczema and psoriasis patients. And like I said, the good news is we have a plethora of options to offer you to help clear your skin.
What if you have an infection, possibly some kind of skin infection? Is that something you want? I know people might think, I might go to my primary care doctor, but I would think a dermatologist would be someone that you should be seeing for an infection.
Absolutely. So when you have an infection, whether it be bacterial or fungal or parasitic, we are the specialists in that area. And the good news is at Apex, we offer same-day appointments. So if you have a concern, it's important to see someone acutely for those issues. So, give us a call. We would love to see you as the dermatology specialists.
What I think is also good too with insurances. Like a lot of insurances are accepted there. They work with you. So this is not something where you're just dishing out your wallet, I guess, out of pocket, where people might think that would be the case.
Oh yeah, absolutely. And we really emphasize the importance of that annual well check, that annual full body skin exam. So we can address that skin cancer, your acne, your psoriasis, your infection if you have one. But we really want to look at you holistically as our patient and make sure that we're addressing all of your skin concerns.
I mean, I experienced it firsthand. I went out, I remember sitting down to get my mold check, and there were just so many other questions that were asked of me that I was like, wow, I didn't even think that they would need to ask me this, or this. And I think the thoroughness that you have there at Apex speaks volumes to what every single person there is doing to just make sure that we are staying safe, healthy, and having great skin.
Yeah, absolutely. And keep in mind, if you have a history of excessive sun exposure, tanning, if you have a family history of skin cancer or atypical moles, those are all risk factors that increase your risk for skin cancer over your lifetime. So definitely, again, that annual skin check is so important to come get a baseline and get to know your risk.
Do it. Make it a part of that every routine that you do. You get your mammograms, you get the colonoscopies. This should be right up there too, because again, the prevention or catching it very early, it's curable then.
Yes.
And that's a big deal.
Absolutely.
And you have how many locations now are we up to? I always ask this. Is it?
We have 14 locations.
I was going to mess it up. I'm glad I asked you again. They're all over Northeast Ohio. You find the closest one near you. I thank you so much for coming in today.
Thanks for having me.